every American understands Medicaid is the way so many working families, so many middle-class families get their health care. And it's not just health care. A lot of our parents, grandparents get their long-term care through Medicaid. In my community and a lot of communities, a lot of the kids get their mental health services in their schools through Medicaid. So hands off of our Medicaid. Let's not cut Medicaid so Elon Musk and Jeff Bezos can get a tax break. Let's actually take care of every American. So as Democratic doctors, we're here to fight to make sure Americans get their health care and we do what's right for America. Exactly. Look at that. That sounds like an ambulance that's taking a Medicaid recipient to the hospital. Hands off for Medicaid, and I want to introduce. Okay, let's hold on. We're good.
Stop. I think. Who's behind them? I didn't know what you were doing. I almost feel like you get a little paranoid.
Right? Who's coming up to the end today? Exactly. Let's see, there's still. We'll start over again. He was on the hill yesterday. Okay. We met with him yesterday. Foreign affairs. Okay. Take two? Take two. Okay. Hi, I'm Congressman Ami Bera from Sacramento, California. I am so pleased to be surrounded by my Democratic congressional doctors. We are here to fight to save Medicaid and make sure our colleagues on the Republican side of the aisle understand that Medicaid is such a vital lifeline to protect so many working class Americans, folks that go to work every day. There's nothing more vital than providing health care. And Medicaid is a lot more than just health care. Our parents, grandparents, a lot of them use Medicaid to get their long-term care. Our kids use Medicaid to get their mental health care in their schools. So hands off of Medicaid. We are going to fight tooth and nail in the cauldron every day to make sure we protect America's health care. We don't need to cut health care to give Elon Musk and Jeff Bezos a tax break. Last I checked, they're doing fairly well. So let's save healthcare. I'm proud to be a doctor. I'm proud to be surrounded by these folks that are in there every day, seeing our kids, seeing our parents, seeing our grandparents. So let me introduce one of our newest doctors in Congress, Herb Conaway from New Jersey. Herb.
Thank you. And good morning, everyone. And thanks for coming out and showing support for this very important effort. This is round two of cuts by a Trump administration to attack the most vulnerable in our society. But what we're here to say is it is wrong to do that, to give tax breaks to the wealthy and the well-off. That's the purpose of these cuts. They're trying to find money to give this tax cut. And it's wrong to take actions that are going to remove the security of health insurance from so many people. At its full extent, millions of people are going to be thrown off of insurance, unable to take care of basic preventative needs and emergency needs. Now, I'm here to comment on the economic impact that I think sometimes is lost when you, when in the zeal to cut the funding that goes out into our communities to support the many institutions that rely on Medicaid for their revenue. Particularly when you get out into the middle of the country and some of these Republican red states. Hospitals there operate, as we've heard, on thin margins. Some of them, their revenues are 40 to 50% of them are made up of payments for Medicaid. You take those payments away to any significant degree, those institutions are going to fail. And that's going to mean people are going to lose their jobs, people are going to lose their health care, and there'll be a ripple effect right through the economies. It can happen in my state. We operate, as we heard, on thin margins. There are not as significant as in the Midwest and some of these other places down south, but institutions rely on Medicaid to be able to provide services not only to Medicaid beneficiaries, but to middle class and other people alike. That hospital falls out of service. That nursing home can no longer operate. The community health care center that's shut down because these cuts take effect and take revenue from them. Healthcare is lost, jobs are lost, and the ripple effect through the economy is lost. There are estimates that in New Jersey alone, um, 10 billion in federal Medicaid funding might come to New Jersey as a result of these Republican plans. Um, it could cost billions of dollars in economic activity. States across the country will see a tremendous drop in their respective GDPs. Again, this is because unemployed people are not spending their money in the economy. Hospitals are the largest employers where they are located. Those job losses will have a very negative impact on the states, their tax base, their ability to handle other things that they need to do as part of their state budget. So I'm here to say again, once again, hands off our Medicaid. It is, I would say, I'm going to use the word immoral to use these cuts as a means of providing tax cuts to the wealthiest people in our country. It's wrong, and we shouldn't do it. And thank you for being here to support that message, which needs to go right straight across the land. It's my privilege to bring forward to you Maxine Dexter, who's in the freshman class, doing a wonderful job advancing the interests of the many patients across our nation and bringing forward policies that are helpful and promote good health care rather than destroying it. Dr. Dexter.
Thank you. Thank you. All right. Good morning. Thank you, Dr. Conway. I am Congresswoman and Dr. Maxine Dexter, a mother. That's the most important job I have, a physician, and a proud representative of the people of Oregon's 3rd Congressional District. And we are all here out today because House Republicans, as Dr. Conway just said, are launching an all-out attack on Medicaid. Hands off our Medicaid. It is not just misguided, it is morally indefensible. In my district alone, 38% of my constituents are covered by Medicaid. 59% of children rely on Medicaid. These aren't just statistics, these are real people who rely on the stability of Medicaid to know that when they get sick, they have the means to get well again. They are cancer patients who are relying on chemotherapy right now. Children with disabilities getting life-saving and also changing support. And seniors who have long-term care needs that they can't make ends meet without Medicaid. What Republicans are proposing is a reverse Robin Hood, taking from the poor to give to the rich. It is absolutely un-American, and we are not going to stand for it. Their plan is to slash $800 billion over 10 years from Medicaid or from the E&C committee. It doesn't matter how you paint this, that cannot come out of the Energy and Commerce Committee unless they cut Medicaid benefits. It's a deliberate choice to trade lives for tax cuts for billionaires. As a critical care physician, I know exactly what happens when people don't have insurance. They postpone care. They don't get the care that I have recommended and what many of my colleagues standing here are recommending. They don't get preventative care, so they show up sicker, they leave less well, and it costs the system far more money. Medicaid is not a handout. We cannot accept that premise. It is a lifeline, and it is our duty as government to provide health care for people. We are the only developed nation in the world who doesn't accept that this is a fundamental right and an obligation of government. And we want to be expanding care. That's what the ACA was trying to do, not take it away. So I refuse to stand by while Republicans try to rig the budget for billionaires on the backs of those who can least afford it. Oregon certainly won't stand for it, neither will I. And because, again, this is what I am proud to do, standing shoulder to shoulder with my fellow physicians in Congress. Together, we formed the Democratic Doctors Caucus to lead the fight to protect Medicaid and defend the dignity of our patients. We will not rest until every American and their has health and healthcare, and especially with Medicaid protected from these reckless and immoral cuts. No one should lose their health care so that billionaires can get a tax cut. And so thank you. I'm now going to pass it off to the amazing Dr. Kelly Morrison, an OB gynecologist, obstetrician and gynecologist by training, and an amazing representative for the people of Minnesota. Thank you.
Good morning, and thank you, Dr. Dexter. I'm Kelly Morris. I represent Minnesota's 3rd District. I'm also the first and only pro-choice OBGYN in Congress. I've had the honor and privilege of caring for women for more than 20 years. And one of the great joys of my job as an OBGYN is caring for my patients during their pregnancies and helping them grow their families. I carry my patients and their stories with me, and they inform my work here in Congress. I think about them and all the challenges new parents face during pregnancy and then after they head home with a new baby. Recovering from the delivery, adjusting to life with a little one, accessing the care they and their family need, balancing caregiving and work, making ends meet, the high cost of raising children in the United States. It's a lot. And I think about all the babies I've delivered whose moms got their health care through Medicaid and how critical that was to help them get off to the best possible start. And because of those patients and patients across our country, I stand here today both incredulous and outraged that the Republican majority in Congress plans to gut Medicaid, the healthcare program that covers 40% of all births and ensures almost half of all children in our country. As an OBGYN, as a mother, as a member of Congress, as an American, it is unconscionable to me. We already have a maternal health care crisis in our country that has been exacerbated by the restriction of access to reproductive health care unleashed by the Dobbs decision almost 3 years ago. And this is coming as the White House is assessing ways to, quote, persuade women to have more children. The hypocrisy is as harmful as it is infuriating. We don't need some of the ideas the White House has floated, like giving medals to women for having 6 or more babies, or paying $5,000 per delivery, or getting the government involved in tracking ovulation. We need moms and new babies to be able to get health care. But that is exactly the opposite of what the Republican majority is doing with their budget. With their budget proposal, they are choosing to take health care away from moms and babies. This will, of course, devastate the moms and new babies who get their health care coverage through Medicaid, but it will also be disastrous for maternal health care across the country. Consider the facts about the maternal health care crisis we face now. And remember, this is before Medicaid is gutted. In more than half our country, women do not have a place to go to get obstetric care. Among our peer nations, the United States has both the highest rate of maternal death and the highest rate of infant deaths. In 2022, there were more than double and sometimes triple the rate of maternal deaths in the United States compared to most other high-income countries. This is an unacceptable crisis and demands immediate action from our nation's legislators. So what is the Republican majority doing about this? Instead of working to find ways to improve women's health and to help moms and babies, they are shoving a budget through that will devastate our nation's maternal health care and decimate many of our hospitals and clinics. At a time when we are facing a literal crisis, why in the world are they doing this? Why are they choosing to harm women and children? They're doing it to pay for tax cuts for the wealthiest among us. That is literally why, to make the math work, to cut taxes for billionaires. They are selling out the health of women, mothers, new babies, the literal future of our country, to pay for tax cuts for billionaires. This from the party that calls itself pro-life and pro-family. It's hard to imagine a more anti-family policy. But I want to be clear here today. This fight is not over. The American people are speaking up and saying that this is not what they want. And Republican legislators are taking note. Recently, more than a dozen Republican state legislators from my home state sent a letter to President Trump and the Republican members of Minnesota's congressional delegation imploring them to not cut Medicaid. They highlighted the dangerous threat that their budget poses to Minnesotans' health and economy. They said it would hurt their constituents and it would put incredible pressure on the state budget. Then a dozen congressional Republicans sent a letter to their leadership voicing their opposition to Medicaid cuts. And today, Republicans have pushed back the committee hearing in which they were scheduled to finalize their Medicaid cuts because they're facing increasing pressure every day. And the resistance opposing these cuts is only getting stronger. And that's because people understand how harmful and how devastating these cuts would be. And they have joined the fight to save Medicaid. Patients, providers, hospitals, state legislators, federal legislators, the American people are coming together to save Medicaid. And they're doing it because they understand that we will all be better off. As Minnesota's former Senator Paul Wellstone was always said, we all do better when we all do better. So I encourage everyone to keep standing up, keep speaking out. And I call on the Republican majority to make their pro-family rhetoric match their policy. Put America's moms and babies first and stop these proposed Medicaid cuts. And with that, I am honored to turn it over to the esteemed and outstanding Representative Dr. Raul Ruiz.
Good morning. I'm Congressman Dr. Raul Ruiz, and I proudly represent California's 25th Congressional District. And as an emergency medicine physician and public health expert, I've seen firsthand what happens when people lose access to care. Cutting Medicaid is not just about numbers on a spreadsheet. Medicaid cuts affect real people, real families, and have real consequences. Let's be clear. Medicaid cuts are not a partisan issue. They are an everybody issue. They affect working families, children, seniors, and veterans in red districts and blue districts alike. And nearly 50% of my constituents in Southern California rely on this essential program. In my district, which includes rural and medically underserved communities, Medicaid is a lifeline. It's known as Medical in California. These cuts would delay care, force patients into already overcrowded emergency departments, and threaten to close local provider offices and hospitals. And we are already seeing this in real time with dire warnings from organizations like the Inland Empire Health Plan. They sent a letter on April 3rd warning that significant cuts would lead to closures of several hospitals and clinics that are already strained due to existing reimbursements rate. Now think about that for a second. You may have Medi-Cal or Medicaid, or you may have private insurance. It doesn't matter. If a hospital closes, they won't have an emergency department there for when you have an emergency. If a clinic closes, you won't have a primary care physician to manage your chronic illness. When you don't have Medicaid, individuals aren't going to be able to afford their medicine, and so they're going to get sicker, and they're going to get into a situation that they're going to need to see an emergency department or an emergency physician or a critical care specialist or an OBGYN or an internist in a hospital. And when they don't have access to these healthcare providers, what do you think is going to happen? So I have taken care of patients who haven't been able to afford their insulin or their medications for their diabetes, and they present to me with a diabetic coma. I've taken care of patients with emphysema who were unable to afford their medication, and they come in with respiratory failure. We are here, all these physicians are here to give voice to those patients, to give voice to the people who need health care, and those that are healthy that we're working diligently to keep healthy. And these hospitals run the risk of buckling under any additional financial stress and will have a direct effect on the ability of Californians and others to access health care in their communities. So hospital closures will affect everyone. If hospitals and clinics close, where do you think people, whether they have private insurance or Medicaid, will go to get care? Additionally, public hospitals rely on Medicaid to stay afloat. If these cuts happen, they'll be forced to reduce the number of doctors and nurses and eliminate critical services. And we know that the services that go first are pediatrics and labor and delivery. And we can't allow that to happen. And we know that there will be longer drives to access healthcare in other communities, longer waits, and more barriers for families needing specialty care. If these proposed cuts move forward, millions of Americans will lose their coverage and their doctors. Another 2.8 million will fall into medical debt. That's a $26 billion increase in what Americans already owe to stay alive, a 10% spike in the national medical debt. Even Republican leadership knows how harmful these cuts would be. That's why they postponed releasing their legislation to cut Medicaid, because they're hearing the same thing we are. Americans rely on Medicaid and they can't afford to lose it. We need to strengthen Medicaid, not gut it. We need to support our healthcare providers, expand access, especially in rural, medically under-resourced communities. And I will continue fighting to ensure every American, no matter their zip code, can get the affordable, life-saving care that they deserve. And so thank you. And at this point, I want to introduce my friend and colleague and fellow Energy and Commerce Committee, Health Subcommittee, Congresswoman Dr. Kim Schreier from the great state of Washington.
Good morning, and thank you, Dr. Ruiz, and thank you to all of you for your attention to this really important issue. Like my colleagues, I am so frustrated that once again we are having to fight Republican attempts to cut Medicaid. But I will tell you that it is an honor to stand arm in arm with my fellow Democratic doctors as the Doc Caucus to stand up for our patients and take this on together. We all took an oath to protect our patients. And I think of this, we think of this as an extension of that oath and a reflection of our values. These Republican cuts would be a direct attack on the most vulnerable people in our communities, like people with disabilities and children. And they would decimate our overall healthcare system. And I want to explain that. Our healthcare system in the United States is like a three-legged stool. And one of those legs, covering 1 out of 3 Americans, is Medicaid. It's called Apple Health in Washington State. 1 out of 3 of my constituents relies on Apple Health. And when you chop one of those legs of the stool, the entire system crumbles. It means that all of us, not just those who are dependent on Medicaid for their own care, will be impacted. Look, people with Medicaid, they're still going to get care, but it won't be paid for. It'll be too late. Things will be more serious, and it will be care in the emergency department where the care is most expensive and it is the most crowded place to get care. And so when you're rushing to your local emergency department for acute chest pain, you'll be in a long line behind patients who I see with ear infections and coughs and shortness of breath and fevers. And your insurance costs will rise in order to cover these costs and keep our healthcare system afloat. And if your local hospital, despite all of that, can't make ends meet because it's providing this care for free, it's going to first cut services like labor and delivery and pediatrics and drug treatment and mental health, or that hospital or clinic is going to close. And this is particularly true in rural areas, like in my district in Washington State. And that is what I mean by saying that cuts to Medicaid endanger our entire US healthcare system. Now, as a pediatrician, I am always focused on children's health. And I am so outraged that Republicans in Congress are taking a hatchet to the program that covers over 40% of children in this country. That is 38 million children who are at risk of losing their health insurance. And their parents are at risk too. I mean, with all of their talk about bureaucracies and red tape, House Republicans are creating more of it. They're essentially making families have to reapply for Medicaid every several months. We know that this would be a disaster because we've seen it before. Texas, Georgia, Arkansas, people who were still eligible for Medicaid lost coverage because of missing or incomplete paperwork. And states spent more money dealing with that paperwork than taking care of those patients and providing health care. That's just plain wrong. Republicans have spent the last few months telling anyone who would listen about improving government efficiency and rooting out waste in the system. And yet here they are trying to implement policies that would cost more money, that would create mountains of paperwork and red tape, and that will leave us all sicker and poorer. So do not be fooled. This is not about efficiency. It is not about cutting waste. This isn't about the budget, balancing the budget, dealing with our debt, or fiscal conservatism. Their motivation is disgusting. They are looking to cut health care for our constituents in order to pay for a gigantic tax cut for billionaires. It is cruel, it's dangerous, and it is immoral. And I won't stand for it, and neither will my colleagues. So here's my oath. I am going to fight like hell every day on behalf of the people that I represent and the people in this country to defend Medicaid, to prevent these cuts, and I'm going to do it arm in arm with the Doc Caucus, my fellow Democratic doctors in Congress. Thank you.
Thank you, everybody, for coming. Thank you to all the physicians that are standing arm in arm here behind the podium. This fight is not over. This fight is just beginning. Soon they will reveal the numerous ways how they're going to take away health care from millions of people, and we're not going to stand by to let them do it without the biggest fight that we've ever mounted here in Washington, D.C. So thank you all, the doctors that are here. Thank you for being here. Thank you. Thank you. That concludes our press conference.